Thank you everyone for joining today's webinar entitled A Family Affair, Including Siblings in the Conversation About a Rare Diagnosis. My name is Nikki Young, and I'm a program manager with Child Neurology Foundation. Today's talk is part of our 2021 education series. Each topic focuses on what we heard from our partners and our families as a top priority. So first, I'd like to thank our education series partners. Without them, this wouldn't be possible. We have Amicus Therapeutics, Bluebird Bio, Greenwich Biosciences, BNS Therapy by LivaNova, Origin, PTC Therapeutics, Regenix Bio, Taysha Gene Therapies, and UCB. We appreciate your support. So I'd like to introduce you to our speakers today. We'll be hearing from three perspectives. Our first speakers are Beth and Carlo Giuffre. They can correct me on their name. Okay. They are family to Luke, who is living with Fire syndrome. It is febrile infection-related epilepsy syndrome. Our second speaker is Nathan Grant, president and founder of Siblings with a Mission. And our third speaker in moderating the conversation today is Brad Thompson, licensed professional counselor and peer support trainer here at the Child Neurology Foundation. If you have any questions, please submit them via the Q&A box, and we'll spend the last 15 minutes today getting those. And with that, I will pass it over to Brad.
So good afternoon to all of you who are joining us, and we want you to know that we're humbled to have the opportunity, and I'm especially excited about the conversation that we're going to have over the next few minutes, because I love my role in this. I just get to ask questions, and these guys are going to provide the expert content. So I'm really excited. Having met with them a few times, I think you're in for a treat in getting to hear from them about what is a very important topic around the other kids in the family, basically the siblings, and how we relate to them and how we encourage and communicate and all of those things. So I'm really excited. And as Nikki said, I'm Brad Thompson. I'm a licensed professional counselor in Amarillo, Texas. I get to work with families who have children with special needs across the country and locally in a very one-on-one setting, which is really the joy of my life, other than my family, who have really made all of this possible. So I'm married to Karen. It will be, my math skills are really poor, but I think it'll be 36 years in December. We have two children, Haley, who is 32, who has a variety of different special needs, and Justin, our son, who is a little older, he's 34. And so we've experienced some of these things around and around. And I love to hear the perspectives of others. And so that being said, I want to first introduce you to Beth and Carlo, and let Beth and Carlo introduce themselves a little bit. Then we'll have Nathan introduce himself a little, and then we'll just jump into some conversation.
Okay, well, thank you, Brad. Hello, everyone. I'm Beth, and this is Carlo, and we are a family of five living in Florida. We moved here in January after moving from California, and our son, Luke, our youngest of three boys, has intractable epilepsy, Fire syndrome, and it's all started when he was age 6. So he was completely functioning normally until then. And we've been through many treatments, but the one where we were introduced to the Child Neurology Foundation was after visiting the Mayo Clinic in Minnesota to be diagnosed with Fire syndrome. And that was years after, that was 5 years after many treatments that didn't work. And it's been wonderful being connected to this group, because we have met Brad and Nathan and Nikki, and really, I will talk about it later, but the support that you can get from a very good therapist is invaluable. And unfortunately, I haven't met anybody until Brad. So I'm going to be talking about that, but as far as Carlo's our oldest, and he's seen Luke change from being really advanced and really funny and really cool and tight-knit group to cognitive decline over the years. And now he has daily seizures. We've had about 25 different treatments, medications that made him very violent and aggressive and all that stuff. So this is Carlo. Did you want to say anything, Carlo?
Yeah. Throughout my years, I don't remember Luke first getting his diagnosis or start actually having seizures because I was so young back in the day. He's kind of been like this my entire life. I don't remember him beforehand, but I'm sure he was amazing. During my time with Luke, I've been learning really how to cope with it. And over the years, I've been getting better and better. And I've come to terms. So I'd like to talk about that later.
Great. So Nathan, tell us a little bit about you and your experience as having a brother and the work even that you're doing in adulthood to support families and folks like you.
Thank you, Brad, and thank you to the Child Neurology Foundation for putting this together. My name is Nathan Grant, and I am from Cincinnati, Ohio. My twin brother, Nick, has a very rare genetic disorder called mucopolysaccharidosis, or MPS type 2. It's also referred to as Hunter syndrome. And very similar to Beth and Carlo, he's experienced severe seizures over the years. He has both some physical disability, but also very significant cognitive disability. He needs 24/7 support and assistance throughout the day, which comes both from my parents and also from me, especially while I've been at home. He was diagnosed with his disease at the age of 3, and we've attended numerous medical appointments ever since then, which I'm happy to talk more about. But attending those appointments and living with my brother and providing care for him has just been my biggest inspiration. Nick inspires me in everything that I do. Seeing him and some of the struggles that he's gone through with his disease has really motivated me to pursue an education and career in the medical field. I did my bachelor's in science at Harvard College. I studied molecular and cellular biology and a minor in medical anthropology. And I graduated in 2020, and then I did my master's in philosophy at University of Cambridge, where I specifically researched how families manage challenging behaviors in Hunter syndrome, my brother's disease. And right now I'm doing some research at the University of Minnesota with some researchers who I'm happy to say are on this call today, which is, they've just been my biggest inspiration as well, just working with them. And we're specifically trying to find resources and interventions to help people with my brother's disease, which has been incredible experience. And my plans for the next year is to go to medical school to continue to help people like my brother with similar conditions. And outside of school and spending time with my family, I run a support group called Siblings with a Mission, and we're an international organization that supports siblings who have brothers and sisters with various health conditions, as well as sibling supporters. And through the Siblings with a Mission, I was able to connect with the Child Neurology Foundation and some of the sibling work that they are doing. And it's really incredible to see, just because, you know, growing up, there were no resources for siblings. There were support groups for my parents, oftentimes also for spouses, and parents they were always included in medical conversations, but me, I was really never included in those growing up. It's gotten a lot better now as more events like and foundations like the Child Neurology Foundation is putting together to raise awareness, but very, very little, there was really nothing for siblings. And that's what encouraged me to start Siblings with a Mission, to connect with other people and show that siblings have various roles as caregivers and also just as being a brother and sister. So I'm happy to be here, and thank you all for joining.
Great. Nathan, one of the things I really appreciate about Nathan in the few conversations we've had is that he keeps it dummied down so that I can understand it. He doesn't speak Harvard or Cambridge. He speaks common folk language. So I'm grateful for that. So, as we talk about this, and Nathan alluded to it, that one of the challenges is when we as parents get the news that we have a child with a disability and a diagnosis. And I think especially as it becomes more and more rare, it's really easy to get so engaged in the process of figuring it out and what we do with that the other kids, if there are other kids in the family, can easily take a back seat. And sometimes the kids even tell parents to put them in the back seat. Almost, it's like you try really hard to not create any stir or any burden or any of those things, because you have this built-in sensation, thought, awareness that you have a brother or sister that's really challenging, and your parents really need to be there. And what I want y'all to know is that you deserve your parents, and you deserve their attention, and you need it, and they're trying to do it, and we as parents are just trying to figure it out. All right. And y'all didn't come with a rule book, and your siblings didn't come with a rule book. So we're just trying to figure it out. And that's why we just want to have these conversations, not say, boy, we did it this way and you should too, or boy, we did it that way and we really messed it up. Don't do that. But to just open the dialogue so that it's safe to talk about it. So it's safe to talk about your feelings and your experiences. And so with that being said, I just want to start it, and don't care who goes first. But how did your family originally share that in both of y'all's cases, you had a brother with a disability and a rare diagnosis at that? Beth, let me start with you. Okay. Let me start with you as a parent. What went through your mind, and how did you do that?
Okay, so we did not have a formal talk about the diagnosis because the kids were so young. So we have 3 boys. Carlo's our oldest. He's 17 now, but he was in 7th grade at the time. So he was like 9. And then our middle son, Tony, was 8. So they're all really close in 7. Yeah. So they're all really close in age. And we just decided, well, actually, we didn't decide anything. It was chaos. It was survival. And we just really, just the way we are, being my husband's side being Italian, my side being Irish, we were just, just everything coming out, emotions, everything. We didn't keep anything inside, and we talked about everything. And that definitely was a benefit, to just be able to talk about it and let the kids express themselves. And I think that when they were little, we used very easy words, and we didn't even know what the diagnosis was until we really tried to say, oh, maybe these seizures are going to go away for the longest time. I mean, for years we're still looking to stop the seizures. But, I think that one of the big things that not many people realize is that 30% of those with epilepsy do not get seizure control. And we're in that 30%. And we even have the diagnosis of pharmacoresistant. So none of the drugs work, and we've tried all different things. So just using words like, seizure, the kids didn't learn about epilepsy until just a few years ago, really. So we just, made it kid-like, and we were open about it. So I don't think Carlo will remember a talk. Do you remember a talk?
So Carlo, how did you, if we want to call that an approach, and I actually think is a great approach, because this is our family and you're just open and honest about it, and it's safe. How did that affect the way you grew up with your brother, Carlo?
Well, because we didn't really have a talk, it kind of became part of my life, and it wasn't that big a deal, really. Kind of just like a matter of fact thing.
Yeah.
I was confused at first. I was like, why is Luke acting this way? I don't get it. And when my mom and dad tried to explain, I wouldn't get it. And so over time, Luke and I kind of grew apart because he wasn't really growing along with me with his mind. So my brother Tony and I, other brother, kind of grew a little closer together, and ignored him a little more. We were young and cruel, and but as we grew up, we got better with it. We just kind of understood, and because life was going along this way, I kind of just accepted that this is going to go on for as long as it takes, and I shouldn't really be down about it, because you can't, you shouldn't fret over what you can't control.
That's awfully mature. Maybe I'm writing that down to try to start living by not fretting over what I can't control. Thanks for that, Nathan. Twins are a very different group of people anyway, and so so you're exactly the same age. I'm very educated, Nathan, that I could figure that out. So how did that happen with your family?
Yeah, it actually had some similarities to Beth and Carlo, but so my brother, he was diagnosed at the age of 3. That's when a lot of his signs appeared. He had a lot of recurrent ear infections, developmental delay with his disease. He had enlarged liver and spleen. So my parents took him to many doctor's appointments, and after they did some genetic testing, it came back positive for Hunter syndrome. So there were several appointments that happened before then. But once he got the diagnosis with the disease, there's a short life expectancy. Some people live till 10, some live till 20. So it was a huge urgency to treat right away. At the time, the only option was a bone marrow transplant back when my brother was diagnosed, or just monitoring. So we really did, my parents rushed to get the treatment. It was just like Beth was saying, just a need to survive. So at the age of 3, my brother had not 1, but 2 bone marrow transplants. He was in the hospital for about 9 months.
Wow.
And at that time, I stayed at a hotel near the hospital with my grandparents. So I didn't know exactly all that was going on, and I was young, so I don't remember all too much, but I do remember my grandparents taking me to the hospital when we could. And I would see my brother connected to so many different cords for his medications. And I remember trying to make sure like he wouldn't trip on his cords, and just trying to help as much as I could, even though that I was 3. And I think just seeing his medical intensity at that young age, and how that's honestly continued to this day with still constant medical appointments and medication needs, that's made me really be there to continue to provide support. But kind of like what Carla was saying, my parents gave me some information at the beginning. They said that he was sick and needed to be in the hospital. And then as I aged, I got more and more information to better understand his condition. Like around 7th grade, when we started learning more about DNA and genes, I started understanding better some of the genetic components of the condition. And I'm also really grateful that there's a foundation called the MPS Society, which supports people with the disease, and they have a lot of age appropriate and family information on their website, which helped me better understand the condition. but just having access to these resources as I aged and could understand it was extremely helpful. And then maybe around the age of 11, we started attending family support groups, conferences where I better understood the condition. But Brad, it is a constant learning. Even the providers are constantly learning about the disease and treatments. And there's a huge need just to keep on staying informed with the information.
Sure, sure. So I'm going to skip a question on your list because I really want this to focus on family. And so Nathan and Carlo, what I want to know is how are some ways that your parents prioritized you, even in the middle of treatments and doctor's appointments and just the day in, day out care for your brothers? How did they do making you feel special and having your turn?
We would go get ice cream a lot. My mom and I after school.
Yeah.
I did my homework and we got ice cream, and she takes Tony out too sometimes, my other brother. Sometimes we go to movies. We take Luke to restaurants, but sometimes we have our own little restaurant times. And we talk a lot. Usually when he's out of the room sometimes, just to give ourselves a little space, breathing room, because sometimes he can be a little overbearing. But even though he's overbearing, we have to give him some attention too. And when we do, it actually feels pretty nice. It's a lot better than ignoring him, for sure. Makes you feel a lot better for yourself. But yeah, definitely some alone time is needed because to focus on our mental health as well.
Yeah. Tell me about that feeling better about yourself.
Feeling?
Yeah, you said when I give him attention, it just does something for me too. Can you kind of speak into that? I mean, we serve people to serve people, and we love people to love people, but it does do something for us. And I'm just wondering if you could kind of put that into words for people. What is it that does for you?
Well, when I can say that when I ignore him, sometimes it racks up day by day. The more and more I do that, it really hurts my soul, really. You keep getting in the habit of ignoring him, and then sooner or later, I found myself one day, he started just talking to me, and then I actually can't hear what he's saying because I'm so in tune of tuning him out. And then at that point, I was like, oh, I got to stop this. He's my brother. For goodness sake. So, yeah, when I start playing with him, I realized, man, he's actually got a lot of fun in him. And he's got a lot of love. He hugs me a lot. And I kind of got to appreciate that too. He's still my brother. I love him. And
Wow.
yeah, the more and more I play with him, even when I don't want to, it kind of like helps with my patience. It helps with my appreciation of him because I really need him. And those hugs really show that.
Man, I'm glad I asked you that question, Carlo. That was rich, and I appreciate that. Nathan, what about you and how your parents prioritized you over time?
Yeah, it definitely is hard, especially when my brother needs really so constant, frequent support. But I'm really grateful that my parents often made time, like on a Friday, to just go out to dinner with just my mom and dad and me. We did need to have like a babysitter or a family member be with my brother for that time so that we could go do those things. But that was just really important. That was having that time with my parents helped me talk about some of the worries that I had about Nick, especially like growing up worrying about, what's the future going to be like when if Nick keeps continuing to get sick. So having those independent one-on-one time with my mom and dad was really helpful. I would say like during our teen years in particular, my brother started having really severe behavioral problems. He became very aggressive. And that was just really, really hard for all of us in the house. He still sometimes has some behaviors, but we've been trying to find some resources to help, including some residential facilities to do that. But when he had those behaviors, that time was even more important for me to be able to speak with my parents about all the things that are going on at home, and having that individual one-on-one time was even more necessary. So I would say, like, when your child, someone, family member, loved one with a disability condition becomes very sick, it's even more important to find time to have to spend with the other members in the household, with the siblings. And I thought, yeah, Carlo, exactly. Like, I think that I feel so much better when I'm able to spend time and provide care for my brother, even though it can be challenging, particularly when he is aggressive. But what I've seen is, like, my parents, we all worry so much about how my brother is doing, his well-being. And I've noticed, like, when we are there to provide care for him, it helps him feel better. But not only does it help him feel better, it also helps us feel better, because we are even less worried. There's still some worry, but that's even a little bit less when we know that Nick is okay, and he's somewhat stable with his medical condition.
Good. Yeah, those are great words. And just to make sure everyone who's joining us knows, you feel free to post questions, and we're going to take some time at the end to answer any of those questions you might have. And these guys are great about answering them. I know that having a Haley in our house greatly impacted the way we functioned as a family. And to this day, it still does. We have to make different arrangements, and it makes our family look different, even than our extended families. Their nuclear families get to function in very different ways than ours does. How, as you look into that and look back on that, how has having your brothers impacted the dynamic of your family? And Beth, I'd love to hear from you about that as well.
Yeah, I would like to start with what didn't work.
Okay.
I do have more of what did work, but what didn't work was, at the beginning, just thinking that every doctor's appointment, we were going to get some kind of answer, and some sort of answer to our family dynamic, which was falling apart. And really, that's what we were so worried about, was, how are Carlo and Tony going to do? We just had so much guilt about spending so much time with Luke and not the other two, that we would, and if I have any advice for parents who are new to this, it's like, when you go to those doctor's appointments, those neurologist appointments or epileptologist appointments, I needed to learn that they have a certain role, and that role is not family counseling. And I don't know why I expected it to be like that. I just thought that maybe there'd be some sort of support or answer to the bigger problem, which was our family being suffering from, Carlo suffering from watching his brother and feeling guilty for not wanting to play with him, and just so what I would say is that what we did wrong was we looked to doctors and teachers and even our extended family and even counselors to figure it out, when what needs to happen right away when you get a rare diagnosis is you have to look at your coping skills and say, oh my gosh, what are we doing? Because if you have one member, if you're married, and they cope with alcohol, or they yell or something like that, that has a more profound effect than the seizure happening in the living room. If one is yelling, it is, that's what was hard on the boys. So, you know, if I were to give any advice right off, it's work on your marriage, work on your support
Mm,
system,
mm,
not through the doctors, not through I mean, that is, I mean, they will definitely be able to give you the medicines. They will be able to prescribe those types of things, but they are not trained for what comes to the family. And that is something that we had to learn the hard way.
mm,
And the second thing we did wrong was we made our kids play with Luke. And Luke has a lot of behaviors that he learned that are really hard to deal with. He talks from morning to night, and it's mostly scripting, it's mostly movie lines and things like that. And he's all love, but it's repetitive and it's very difficult. So making them play really affects them and it makes them feel bad. So we did that wrong when we said you need to go play with your brother. Instead, we developed something that we heard from a friend, and it works like every time, and it is called the time in. And when we are completely frustrated and need time to ourselves, anyone in the family can say, I need a time in, and then no one can talk to them.
mm.
And you just get to be left alone. And it's the only way that our family has really stayed sane. Um, and then the other technique that we learned is at the dinner table, we learned, you know, that we were having so many crises. There are so many, you know, tonic-clonic seizures that happen just on a constant basis that you're constantly pressing reset. So we needed a constant. And what worked for us was having our highs and lows at dinner. And so, and Luke loves this. He loves to start it. And we all go around the table and we all have to listen. And we say, what was your high and what was your low? And, you know, a lot of times Luke says, it was my seizure. And, you know, and we can all just say it. So that's one thing that really helps. And these guys are able to say what's really on their mind. And a lot of times it wasn't the seizure, you know,
Mm.
that was their low. They had a lot of other things that went on. And what worked also was just allowing them to really beef up their friendships, because we realized that we couldn't be like you know, like our extended family and friends. You
Mhm,
know, I
mhm.
wish that we could, but we had to just allow them to go over and have time with their friends, and maybe not have people over at our house because those play dates just never worked out. It was just too chaotic. But just letting them go, we had to learn how to do that. So that worked. And also we got a babysitter who really loved gaming, and that was great because she would love to hang out with the siblings and not just Luke. So
Mm,
we were
right.
able to work on our marriage, and she was able to spend time with all of them and not just Luke. So
Yeah.
those are some good ones.
Super, super.
Yeah.
Nathan, sorry, Carlo, your mom took all that time, but it was
Sorry,
awesome.
Mom.
No, it was fantastic because you gave us some real strategies that we can use. It's not just theory, and I really love and appreciate that. So thank you for that. I wonder if there was a different dynamic in the Grant house as y'all were navigating that and your parents were navigating that.
Sure. Thanks, Brad. I can make that quick too. And Carlo, if you have anything to add, what I was just going to say is I think having a sibling with MPS has actually ironically brought us closer together as a household. With his disease, there's just so much to do in terms of caregiving. Just right in the morning at 8 a.m. all the way till 10 p.m. It's go, 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 changing multiple diapers, toileting, dressing, bathing, medications, preparing meals. And then if there's a medical appointment, there's running to that. And I think really all of those activities just really helped us bond in a way. We would often share caregiving responsibilities coordinating that between our family, between me, my mom, my dad. Even though I was young, that's something I do want to emphasize is I was still really involved in some of the caregiving and support. I'm not as heavily involved in some of the direct care tasks that, like, for example, when it's very severe with behaviors, trying to manage that. But what I do help take my brother out for a walk, for example, when I can, when he's happy. So also just being a friend and a supporter to him for that as well. But those things really did bring us together. And I do also want to just emphasize that there, while there's so many ways we come together with caregiving, it can also cause some stress and also some burnout. So kind of what Beth was saying was it's really important for us also to find time to not do caregiving. So the balance is what's crucial to maintaining our family and our household together. We would have to get a residential, we've had to receive support from a residential facility for multiple reasons for my brother, mainly his behaviors, but that by doing that, that's given my family some time to spend time on our own. My parents have been able to go on some really helpful vacations and much needed rest because of that. So even just doing some respite and finding even asking other family members can be very helpful. But yeah.
I think those are great thoughts, Nathan, and recognizing, overcoming the guilt of, but I shouldn't have to have respite care. I shouldn't need these breaks. And that's a myth that is just, it's life stealing to do the things to keep your other relationships healthy. All of you are just giving us great information there. So I want to throw this out to all of you. And it might be our last kind of scripted question. How do you find time for yourself and even plan for your future without feeling guilty about it?
Well, I've never really felt guilty looking for my future. I think it's a good coping mechanism, definitely, to think about what's to come. I mean, I won't be in the house always, so that's okay. And I think leaving Luke behind to go on to do whatever I'm gonna do. I'm 17. I gotta go. I think that's fine. Because eventually I'll have to leave Luke, and I am definitely, and having that space and coming back to him will always be pretty nice. Yeah, as we were saying, like taking time away is okay.
Yeah.
Yeah, this is probably one of the hardest questions. With me finishing college, it's something I'm really trying to consider is what will the future look like with my brother, especially as my parents are aging and having some health concerns on their own. It's something that worries me of who will take care of Nick, and how will I balance that with my own career. I'm excited to share that I just got into medical school this week, so I'm
Awesome.
super excited about having that opportunity. But that's something I need to consider is, where will my brother be? My brother's in Ohio and he does get Medicaid funding for his services. So he kind of is, in a way stuck in Ohio based on where the funding and the waiver is. So that is a big concern of, will I need to keep my career in Ohio? And then that way, will my school need to be helpful for me to stay in Ohio? And that does make me feel guilty if I have to think about leaving, going somewhere away from Ohio, away from Nick. But I also know that it's important for me to also to pursue my own interests and passions. And that was what I'm so grateful that I was able to do that, going to college in Boston and school in England. That was a really important life experience for me. And I want to be able to continue doing that. So one thing that was really helpful was I used FaceTime a lot when I was away. So even though I couldn't specifically stay close to my brother, I was still able to use technology to keep in touch and say hi to him. And I think he understood over time that I'm actually talking to him. I think it took some time and that was hard, but FaceTime was really helpful. You Skype or Zoom now. I also stayed involved with a lot of his medical appointments, being involved in phone calls, looking up articles for some of the intense things that he's gone through over the years. And that's kind of helped me confront some of the guilt of not being there physically, but I can still be there emotionally, and in a supportive role in that sense. But I think it is a constant thing, and I'd encourage families and also providers to encourage families to have conversations about the future, what that will look like. It's really not too early. Now is really a great time to begin in any way. Just having simple conversations with young children about the condition and the care needs. But I would just encourage that when the family feels ready.
Yeah. Beth, as a parent, any additional thoughts to what these guys have shared?
Yeah, in our family, I really didn't even train them on administering the emergency medication or anything like that until just recently. In our family, they just weren't ready, and I felt like they needed to just have their own things, have their own friends, and really, it's been tough with the move because they had to leave their friends, but we're constantly trying to let them be independent in that way. And then the way that we bring them in when they have time with us is I make an effort to hug them every day, and I let them let go. I don't do the letting go. Because then it's a good gauge to know what they need. You didn't know I did that. But also just little notes. If when I'm off, we do spend a lot of time in hospitals, just like Nathan said. It's just constant appointments, and I don't really take these guys because they're older now. I used to try to arrange it so they wouldn't have to come, and so I give them little notes like, hey, this is what we're doing, or just check-ins, and I make sure I'm there for breakfast. I work and everything, so I always make sure I'm there for breakfast and there when they get home from school. And when we go out as a family, a lot of times we divide and conquer, because they don't need to have to deal with a seizure all the time or the worry of a seizure. We got a wheelchair so that we could get out of certain situations. That was also a game changer for us. Something little like that was huge. And so that if Luke did have a seizure and we were all doing something really awesome, like at an amusement park, then one of us could just be the caregiver for Luke, and then these guys just go have some fun, even though sometimes they're like, no, we're not going to go have fun. Luke's not doing well, but it's really, really important that they just have their own life. So that's what we work on every single day.
I love that, Beth, because I think that is one of the keys to our typically developing siblings not growing resentful and rebellious, is that they get to have their life. And so just encouraging families to do that. And you guys have filled 45 minutes quickly. And so we have some space for some questions. And Nikki's gonna handle that part of it. So I'm gonna turn it back over to you, Nikki.
Thank you. Thank you guys so much. We've got a lot of great questions coming in. The first one is from a provider, and this is for Nathan or Carlo. How have you as a sibling reacted to or coped with seeing your parents stress or grieve? Seeing parents, they have expressed concerns about whether their unaffected children are witnessing that stress, trauma, or grief, and it's actually harming them. How would you guys react to this? What perspective or insights can you provide? And maybe start with you, Nathan.
Sure. It's a good question. I think it's a very difficult task and experience. Seen my parents, particularly my mom, be very, very stressed out, especially as my brother's gotten sicker over the years with his disease progression. But what I would say is just, I'm glad that I was able to see my mom and some of the challenges and some of the mental breakdowns. I'm glad that she didn't hide it, because I would feel like I was really left out, and I would feel like I wouldn't understand what's going on. If something was happening to my parents with their stress, there's no way that they would be able to just hide that. They would obviously feel very concerned. Their minds would be somewhere else. And if they didn't tell me what was going on, it would just not only be awkward, but just be really just even more stressful in a way, just because I wouldn't fully understand. I do think it might matter based on the age of the sibling. But one thing I would recommend to parents and families and providers is to really include siblings in conversations at any age and provide age appropriate information about what's going on. If there is a concern, often just giving that information to the sibling can help them find ways to deal with their own stress. And if the sibling's informed, maybe they can even find ways to help the parent, which could improve not only outcomes for the patient, but for the entire family. So that's also like using age appropriate information from foundations, from hospitals. One thing I really do think is hospitals would be wonderful. It's great what they're doing for patients, but I really do believe hospitals and providers need to give information to the family too. Really excellent care for the patient does involve excellent care for the family. So that would be my recommendation, but I do know it's a constant, it's a hard thing to experience. I wonder, and Carlo, if you had anything to add.
Yeah, in our house, we're always trying ways to minimize our stress. And sometimes my parents do get stressed out because it makes sense. It's hard to deal with. And it used to affect me a lot more, but a lot better coping with it now. Sometimes the stress kind of wears down after a while and you get better at coping with it. And one of the best ways to cope with it is talking. Like we talk a lot, especially if like a seizure happens, then we talk it down. It used to be a lot longer conversations, but it's gotten really short now. It's like, yeah, you got a seizure. Yeah, definitely talking with like sibling to parent. That's a good way to make sense of things, because sometimes you can't make sense of it on your own. And definitely parents talking to one another. Good communication there is important. Like you don't want that get different ideas. It's not good to handle stress on your own.
Brad, did you want to add anything?
Well, these guys kind of, I coming from a parent and speaking to parents, I want to balance these two things. That I want to be careful that I'm not treating my typically developing siblings as little adults, third, fourth parents, or counselors, that they're not equipped to fill that role. And at the same time, I need to be communicating, because they're having feelings too. And if they don't see me processing them, then they have no idea what to do with them, and may even think there's something wrong with them because mom and dad aren't feeling this. And so why am I? And of course, it's a really tricky balance, but finding that line between, and Nathan and Carlo both said it, being age appropriate as best we can, not making our other kids grow up too fast. And at the same time, creating this air of it's okay to talk about it, because I know you're experiencing it too. I think it's really important.
So I'm going to kind of group a couple questions. One thing that was brought up was, how do you explain your sibling's condition to other people? How do you talk to your friends? Or, Beth, you mentioned earlier that you don't have play dates at your house very much. So how do you talk to your friends about your sibling? And let's start with Carla.
Sorry?
How do you explain to your buddies about seizures?
Oh
Like
yes.
James and
Okay.
Michael and those guys.
Yeah, it was a pretty quick conversation. I told them that about it, and they seemed very accepting about it. We don't talk about it that much. It's as far as friends, we don't talk about that kind of stuff because friend time is friend time, Luke time is Luke time, and um, although yeah, if Luke's friends, we talk to about that, but my friends not really much.
Nathan, anything from your perspective?
I was really fortunate that, well, actually, I'll start. I didn't talk about it growing up until probably my junior year of high school. I really, um, I don't know. It was hard for me to talk about it with friends. When people stared at my brother, like in public, I got very upset and often stared right back. It was a very hard thing for me to do to share it to the general public and other people outside the home. But for some reason, I was like, there was an International MPS Awareness Day, May 15th, and I shared with my school at an assembly about my brother's condition. And I realized that I was so afraid that people were judging my brother, like when they stared. But after doing that speech at the assembly, I realized that people weren't judging. They were just curious to learn more about why my brother was like in a stroller, like Beth, what you were saying, like a wheelchair, or why he made noises that were different. And so that made me realize, like, while some people might appreciate understanding some of the science and might have questions of it, it's really just important just to share that my brother has a difference. He communicates differently than you and I, but he still really enjoys like going for walks and eating apples and just kind of providing information in those kind of simple ways, and knowing that people aren't judging, but just want to know more. And that was what was really key. But yes, having play dates, friends over was hard, and sometimes even to this day, I prefer going to other people's houses just because it's easier. But it is helpful to open up in a way that you feel comfortable to.
Yeah. I think those are really good things. One thing I always tell families is, yeah, those can be really hard conversations. And yes, there are judgmental people and people who don't handle it well. But when we're telling the Haley stories and your sibling stories, you're giving the world a chance to love them too. And one of the things that I have found is that there are tons of people in the world who will love them if we will open the door to let them, and they need us to open the door, right?
Brad, remember what we were talking about earlier, is that the greatest thing about having siblings who have a brother or sister with a neurological disorder or rare diagnosis is that they don't see, or at least the ones I know, and Nathan and Carlo are like this, but they don't see disability. And just recently I was just talking to Carlo and I was like, a lot of your friends, have, autism, and some of them have ADHD and ADD. And Carlo was like, what? He does not see disability. And we are raising children who are accepting of others. And they do not have a normal life, and accepting that and being okay with that and letting them be themselves and letting them express themselves has somehow made these children who accept others for who they are. And I think we need a little bit more of that, so it can be a very good thing.
For a lot more, right? I think you're right. And I think you're raising more resilient kids because their life is hard. It's harder than their peers. And because of that, now, again, I don't wish the way Justin grew up on anyone. But he learned some things in growing up with a Haley that he might not have learned any other way. And it has made him a more well-rounded, in many ways, better person. I'm sure we tweaked him in some ways that you'll read about. But I think we don't have to do it perfectly. We just have to do it intentionally. And what I hear from both of your families is that they've been very intentional about you having a turn and getting your space. And yes, it's about your brothers a lot, but it's about you sometimes too. And I think because of that, you have this heart to keep serving. And so I just love that. And I thank your parents for that.
No, we only have a few more minutes left, and I do have some great resources that Nathan shared, and I'd love to share with you all. But I wanted to ask everyone here, any final thoughts or anything in hindsight, anything you wish you'd share with another family so that they can kind of maintain strong bonds throughout their journey, or anything that you wish someone had told you?
Friends, they're a lot more accepting than you might think, and having them around every once in a while is very nice. And like when they're around us, and then Luke's around there too, like they don't mind. They'll sympathize, and it's really nice to have a bunch of people out there to help and sympathize too, because it really helps you connect. Like they get it.
Beth, anything you'd like to add?
Yeah, the friends they all know Luke, and they all know we're just not, we are who we are, and that's fine. And we're actually grateful. There is one thing that UCSF gave me. It's called life support, and these are cards that do you have this, Nathan? It's from
but really cool.
lab method. It was given to us like 5 years into this. But for the provider question, something like this, these are decks of cards: how to deal with grief, how to not get mad at your neurologist, all kinds of stuff like that. And it's so helpful. I wish I just had it earlier. And the other one that I would recommend is this book here. And this is Brad's son. He wrote this, and it's about his experience with his sister. And this is incredible. Those are just two that I would just recommend for everybody.
And Nathan, I'm going to pull up your recommendations for resources, and I'll let you jump in if you want to say anything else.
Yeah, and that's awesome to hear about that book. And Brad, yes, it's a incredible resource that Brad's son wrote. I would just say, just what you're doing today, coming to this event, is just an incredibly important thing to do, to recognize that siblings have unique experiences and support needs and need to be acknowledged. And I would just recommend really including siblings in conversations about their brothers and sisters at an early age, and providing information that they need. Just asking them, like, how are you doing? What can I do to help you? What kinds of resources do you need? And then just really connecting siblings to other siblings can be incredibly impactful. It was really, like today, it's really helpful, Carla, just to hear kind of some of your similar experiences with friendships, and also how your interests too have been, as I've talked to you, how your interest has been impacted by your brother. And that's just really helpful to be able to connect with other siblings. And yeah, Nikki has some resources here for siblings and sibling supporters that could be helpful too, to connect and maintain those connections with other siblings and families.
Thank you, Nathan, for putting this together to take credit.
Yeah.
So thank you all so much for joining us today. This webinar has been recorded and will be made available on our website in the next week. If you have any additional questions for the Child Neurology Foundation or for our speakers, please contact programs@childneurologyfoundation.org. You'll receive a survey link. Let us know what you thought of this webinar and what you'd like to see in future webinars. And have a wonderful rest of your day. Thank you all so much for to our speakers. We appreciate you.
Thank you.
Thank you
Thank
so
you
much.
all. Thank you all so much.